I chose medicine as my career because I think it's one of the most noble professions that there is. I enjoy working with people, and I also have had a keen interest in science. And it really is the perfect blend of bringing those two together. Specifically, I went into hematology oncology, so taking care of patients with cancer because of the rapid need in that area. And what I found very quickly was that there's a huge role for prevention and being proactive about cancer risk, and therefore I actually turned my interest in genetics into a career in cancer genetics. And this has been very fulfilling to really be able to bring the work of genetic testing to patients, address cancer risk, reduce cancer risk, and also now more and more help with treatment of cancers based upon genetic testing. So it's really fulfilling to work with patients and their families about genetic testing, genetic information, and to help address cancer risk and treatment overall. I would say the most rewarding part of being a doctor for me has been really the deep conversations that we have with our patients. And particularly for what I do with cancer genetics is with patients and their families, because the information that we uncover is really relevant to the patient themselves, but also to their family members. I think that when a family and a patient express the value that they have found in coming in for genetic counseling and genetic testing for themselves, for their cancer treatment, for cancer screening, but also for their relatives, that is beyond words. That is so rewarding to hear. Because I think one family at a time, we're making an impact in the population to help really address cancer. The one question that I wish patients would ask more, I think would have to be, how can they become more involved in their care team? I find that patients bring a very important perspective that doctors, nurses, providers, and the overall care team needs to hear to really be able to adequately address their own needs for their care, but also to advance overall patient care. And I think that we need to hear from patients, we need to hear from their families about what are they experiencing, what can be done better, and we take that very seriously and really want to roll that into a higher level of care overall for patients. So I would say patients should not be shy. Really just go for it, speak up, and we would really embrace having more patient involvement on our care teams. I am Dr. Veda Giri. My mission at Jefferson is to improve lives.